This is who the UK will prioritize for coronavirus testing. UK Health Secretary Matt Hancock announced on April 2 that the UK will test 100,000 people per day for coronavirus by the end of April. Hancock, who contracted coronavirus himself, said that he is determined that the UK meet the target. However, BBC News reports that only 13,000 tests are available per day out of the UK's current target of 25,000. According to Hancock, the government is following an order of priority for coronavirus testing. Patients are the first who are tested for the virus, while staff of the National Health Service and their families are prioritized next. The National Health Service is the publicly funded healthcare system of the UK. The government then aims to test critical key workers next. After the patients, staff and their families and critical key workers are tested, they will expand to community. CNN reports that the UK government will be using a 5-pillar testing strategy to reach their target. The government will be testing those in hospitals and in Public Health England labs. Public Health England, under the UK's Department of Health and Social Care, is an executive agency that aims to reduce health inequalities in the nation. The government will then partner with institutes, companies, and universities to build new testing sites and labs. These locations will reportedly be used for the National Health Service staff and their families first. The UK government is also currently working on blood tests that may potentially tell if someone has had the virus and is now immune. According to Hancock, the goal is to have this test made available for home use, needing only a finger prick. Antibody tests, at a rate of 3,500 per week, will be used along with surveys to determine who in the community has had the virus. The British diagnostics industry will also be aided by pharmaceutical companies. Many have criticized the UK government's inability to conduct mass testing. A spokesman for UK Prime Minister Boris Johnson said that they are aware that more needs to be done in relation to testing. Health workers are badly in need of testing to ensure that they are not infected and that they can still work. Without testing but with symptoms of COVID-19, they are made to self-isolate whether or not they are infected.